How do negative symptoms affect schizophrenia diagnosis? Imagine trying to spot something that's missing instead of something that's there. That's what diagnosing schizophrenia can be like when it comes to negative symptoms. These symptoms are not as obvious as hearing voices or seeing things. Instead, they show up as a lack of normal feelings or behaviors. For example, someone might seem emotionally flat, speak very little, or stop caring about things they used to enjoy. They might avoid social interactions and seem unmotivated. These signs are called negative symptoms because they involve the absence of normal functions. According to the Diagnostic and Statistical Manual of Mental Disorders, the 5th edition, or DSM-5, doctors look for certain key symptoms to diagnose schizophrenia. The person must have at least 2 symptoms for a month, and one of those must be a positive symptom like hallucinations, delusions, or disorganized speech. Negative symptoms are not required for the diagnosis, but they are very common. They often stick around for 6 months or longer and can make everyday life much harder. One tricky part about negative symptoms is that they are subtle. They don't stand out as much as hallucinations or delusions. Because of that, they can be missed or mistaken for depression or other conditions. For example, someone who is socially withdrawn might be thought to be shy or sad, but it could be a sign of negative symptoms of schizophrenia. That's why clinicians need to carefully assess these signs to avoid missing them. Negative symptoms have a big impact on how well someone can function day to day. They can make it difficult to work, maintain relationships, or even take care of oneself. Since many medications used for schizophrenia don't work well on negative symptoms, identifying them early is important. Sometimes, these symptoms are primary, meaning they are directly part of schizophrenia. Other times, they are secondary, caused by side effects of medication or depression. In the end, negative symptoms shape the long-term course of schizophrenia. They often make the disorder more disabling and harder to treat. That's why understanding and recognizing these symptoms is a key part of making an accurate diagnosis. It helps doctors plan better treatments and support for those affected.